Chapter 3. Private Insurance Payers and Plans. Private insurance, sometimes called commercial insurance, is often supplied to employees by their employer. Rules for qualifying for private insurance through your employer vary by company, but most full-time employees are offered the benefits of insurance. Although the company will pay to have their employees enrolled in the insurance, the company is also eligible for income tax advantages. Remember, the employee who is the policyholder will still be responsible for paying a monthly premium to maintain active insurance coverage. For people that are self-employed, or who don't qualify for insurance through their employer, they can buy health insurance for themselves and family through any of the companies that offer it. There are several different health insurance companies in the U.S. Below are some of the most common ones that you may have heard of and will likely see in the pharmacy. Employers who supply insurance to their employees do so under group health plans, or GHPs. The Human Resources Department will typically handle the ins and outs of the insurance for the company. Add-ons such as dental and vision can be purchased by the policyholder for an extra fee in addition to the monthly premium. While Human Resources assists policyholders in managing certain benefits and issues, companies will also typically hire pharmacy benefit managers, or PBMs, to manage specifically prescription drug benefits. PBMs are a third-party company contracted with the health plan. Since they are able to represent a large population at once, they can negotiate pricing with the pharmaceutical companies in order to offer cheaper medication prices. PBMs are important, and we'll discuss them more in a little bit. The group health plan is what determines employees' eligibility for benefits. It decides whether or not someone has to be full-time to receive benefits and other inclusion criteria. For employees that qualify, there's an open enrollment period for when they can choose which set of benefits they would like for the following year. This open enrollment period usually only happens once a year in the summer or fall. Several different packages from the same insurance company usually exist for employees to choose from, so this allows employees the choice to determine what will work for them in the future. Self-funded plans are for companies who decide to pay for benefits themselves instead of going through third-party companies. Sometimes this saves the employer money. With this flexibility, the employer is able to make their own provider networks to choose from. These self-funded health plans are not regulated by state laws, as many private plans are. Instead, they are regulated federally by the Employee Retirement Income Security Act of 1974. Here is a list of the most common types of private insurance health plans. We will go into further detail about the Preferred Provider Organizations, PPOs, and HMOs, as these are the most common that you will see. Health Maintenance Organizations, or HMOs, are another type of managed care organization. In an HMO model, patients pay a fixed premium and copays whenever they need services. Patients have their care directed by their primary care physician, or PCP. The PCP acts as a gatekeeper and is in charge of authorizing visits to specialists if needed. Providers within an HMO model can sometimes be an actual employee of the HMO, such as Kaiser Permanente, or they can be self-employed and see both HMO policyholders and non-member patients. HMOs typically pay a single fee to the PCP each month for each policyholder.
In this video, we're going to help you better understand your health insurance and, more importantly, figure out which type is best for you. First, let's take a look at the three types of plans to choose from. With an HMO, or Health Maintenance Organization, you first must choose a primary care physician in your area. Now, the primary care physician is sometimes referred to as a gatekeeper. They're going to be your first stop for care. You can always change your primary care physician. If you need a specialist, your primary care physician will make a referral, and it could take some time to get the approval. With an HMO, you're required to use the limited number of doctors, their connected hospital, and other providers that are members of the HMO network. And an HMO plan does not cover out-of-network care. So the HMO is a more managed type of healthcare plan.